Okay, so we're going to just have a look at setting up an arc line. I'm just going to show you some of the things that you need. Before you start, have everything underneath your trolley. Use the dump trolley actually that's in Resus to carry things into the room with you out of the lines trolley that we check every day. Most of the things that, or everything that you need will be in there. If all our checks are done, everything that you need should be there. The bits that the doctor will need really, and while you're setting up or running through your arc line, doctor can be putting the arc line into the patient. You as nurses will never need to do this, alright? This will be for the doctor, so a couple of little IV dressings. Arc line itself, the little small ones are usually what the doctors use. Sometimes they need the longer arc lines if they're going to go for a femoral artery, but in an emergency situation, usually we use these small ones. And they'll need a little chlorhexidine cleanser, alright, to prepare the skin. From your trolley, really the other main parts that you will need is the actual arc line or transducer cable that you will need to prime in order to give to the doctor, alright, to attach to the patient. Obviously in terms of aseptic technique, we do this as a very clean procedure. It's not a totally sterile procedure. If ever you need to assist with putting in a central line, it is a totally sterile procedure. You need a sterile trolley, and the doctor would have all the drapes and sterile gown and everything on. That usually gets done in ITU. It's very rare that we do those in A&E really. But in terms of the arc line and preparing that, we use our aseptic non-touch technique, which means we have your hands washed using gloves, aprons and everything. This is just a practice one today for me, but for demonstration purposes. But ordinarily you'd be in whatever PPE was appropriate to the patient you're looking after, all right? And then you're very, very careful not to touch any of the critical parts with your hands or even with a gloved hand. You keep everything clean, same as you would for running through normal fluids or anything like that. Okay, so a lot of what you need is in this pack. Just going to open this up to begin with. I like to, on a clean trolley, open this out, and I like to keep the packaging because it's actually, it gives you a lovely sterile feel to begin with, alright, somewhere nice and clean to work off. The other thing that you need is your sodium chloride. It's always 500 mils and it's always sodium chloride. It's also really, really important, and this is something we're not very good at, but we're going to get more strict around, is having this prescribed on our EPMA. So it should always be prescribed by the doctor. And two nurses should always check that that is exactly what you have, alright? Check the expiry date, same as you would with any fluids, and you can open that up just as normal. Okay. I like to think of, when you come to run through an arc line, I like to think of it in 3 stages. So what I tend to think myself is prime, then you apply the pressure, and then you consider the position and get the arc line position correctly for the patient. So in order to prime, you can pop your bag up there if you like, having checked that it is normal saline that you're using. And then again, with clean gloved hands, you start to unpick your packaging here, or the little cabling that it all comes with. It looks confusing, but once you understand what's going on with it, it's less so, I think. So the red bit, and it should always be red when you're grabbing them from the cupboard or from the lines trolley. If it's an arc line, it's a red line, okay? If it's a central line, it's a blue line, and just be really cautious and careful around that. Make sure it's always got the red line through it. That's your arc line. The clear part of this set is the part that goes to the bag, alright, to the bag of saline. And in order to connect to the saline, it's just the same as you would with any fluids really. You just spike your bag, you pop your little clamp, make it close there as you would, okay, and we'll just spike the bag of saline up there. Okay. Grand. Now I spoke to Marianne down in ITU when I was trying to find out a bit more about these new sets, because if you're not familiar with them, or maybe you're a bit of an older nurse like me, you'll be familiar maybe with the set that doesn't have these fancy syringes in it. All the sets that we've been getting in the past year or so have these beautiful syringes, and there's a really good reason for those I'll explain later on. but they do make it slightly more complex to prime, and that's why we're trying to do this little video in order to clear it up for people and to do a bit of teaching around it. Okay? So again, when I spoke to Marianne, she did say there are parts of this set that aren't actually useful to either us or to ITU, and we can safely remove them just to make these sets a little bit less complex to begin with. The first bit we're going to look at is this little extension, all right, at the very end. Marianne says we don't need that. When you go to hand it to the doctor when it's fully primed and ready to go, you can lose this little extension. We keep it at this point just to keep that critical part clean, all right, so you can just keep it on there for now, but ultimately you will lose that, all right. The other part is this little bit above the transducer. This little three-way tap is excess. We don't need this for anything, nor do ITU, okay? And Marianne suggests we also get rid of that, all right? They do it when they're setting up an ITU. We can also safely do it. So again, keeping all your critical ends clean, you can just lose that. You don't need that again. Reconnect and make sure that you're nice and secure there when you reconnect, all right? So again, actually, when I think of priming the line, I also think of that in 3 steps, all right? You can now open your little roller clamp and just feed through that little bit. So you've got a little bit in your chamber to get you going. But essentially running down the line, you're in 3 stages, okay? The first bit is down to this little bit at the transducer, all right? And I like to call this the air port. Air is very important. The pressure of the atmosphere is very important to setting up an arc line and to how it all works. So this little bit on the side, I call the air port because it can feel and sense what atmospheric air is doing at the minute, all right? So that's the first bit that we're going to prime down to, just this far. And when the set comes out of the packet, the little cap that's on there has a hole in it. So actually when you're priming down, you'll know you've got the length of this little air port when you've got saline coming out of this hole. Okay, so just do that now. Even though this roller clamp is open, nothing's coming down the line, and that's because the mechanism of this arc line runs on this little snap plunger. When this is pulled out, fluid will then be allowed to run. So that has to be, yeah, and now you can see you've got saline running down there. Using this little packet means you've somewhere to catch that little bit of fluid on as well, okay? But now you have come down through to here, you've primed down to the little air port. What you can actually do, or should do at this point, is remove that little cap with the hole on it and replace it with one of these alternative ones that come in your pack. So just when you're opening the pack, make sure you don't lose these in the first place. You've got a little spare cap in there that has no hole on it. So at this point, you replace this one with the hole in it with one that hasn't, all right? And I should have said when I was priming down to here, because I only want liquid to go this far, the little stopcock was turned towards the patient, all right, was turned towards the rest of the line. So then the fluid cannot go beyond this point when I was priming that first bit, okay? So the second part, so that's part 1 done, prime to the air port. Second part is priming into this syringe, okay? So again, at this point, I don't want to go as far down as to the patient. So I can turn the little 3-way tap, the little stopcock down where it says off. If you look really carefully, it says off on there. Turn it off towards the patient, so no fluid will come down all the way to the patient. It will just come the length of the syringe, all right? So this is a little two-handed bit, okay? And to do this, you have to pull out on the plunger and down on the syringe at the same time. And this just takes a little bit of practice. And I have found as well, unfortunately, sorry, I should have said to turn the stopcock towards the little air port once you're finished with that, and then that will allow fluid to come on down to your syringe. So that little stopcock is over there to the off position, to the air port, off to the patient, and fluid can now run from here down into your syringe, okay? The way it comes in the packaging, it kind of makes a natural kink, unfortunately, just above. So just make sure that's straightened maybe a little, pull out on the plunger, down in the syringe at the same time. And by holding the syringe upright, which is really important, you can see that any air that's in the system is now collecting at the top of that syringe. And that's really important. Keep that upright, make sure any air bubbles that are there have collected at the top, and that's beautiful. Okay, so now what you do not want to happen is you do not want any air to go back up to the transducer. So it's really important, turn your little stopcock towards the transducer, towards your bag of fluid, to stop anything going back up there. What you're aiming to do now in step 3 is prime the rest of the line down towards the patient, okay? So to make that happen, then you need to turn the little stopcock here up also towards the transducer, so that it's all off above the syringe and now open below the syringe. And then you can just gently start to plunge your syringe down through, okay, and that will push all that air and fluid all the way down the line, okay. And if you just have 7 or 8 mils collected in the syringe, that's more than enough. You'll be able to prime all the way down to the end of the line. And having done all of that, you want to just check that there's absolutely no bubbles, even micro bubbles, in your system all the way down the line. And if you've done it carefully, you shouldn't have. Okay, so at that point you can turn off to the syringe. You're finished just there for now, and keep it off to there, and you have a primed line. All right. So the second part, as I said at the beginning, we do it in basically 3 stages in my head anyway. So we prime and then apply pressure. So to apply pressure, you want to pop your bag of saline into a pressure bag, all right? And we have tons of these. If you can't find any, we should have some in our lines trolley in the bottom drawer. And if you don't, there's a big yellow sharps bin on the left side of the main store. There's lots of extras in there. A little tip I got from one of our sisters who works in ITU quite a bit, and it's just a simple thing, but it's a really clever thing. If when you're putting the bag of saline into the pressure bag, put the right hand side of the bag to the clear side of the pressure bag. That way anyone can come along and check or double check and whatever, change of shift. Everybody can see really clearly that it's definitely in saline in there, and that's really reassuring for anybody coming along behind you, okay? So pop that back up on there. We can see it's a normal saline. We're absolutely confident of that, and that's lovely. And then we just need to prime your, or add your pressure to the line really. So to do that, we just quite quickly as we can start to pump up on the little bag around the fluid. And where you're aiming to get to is 300 millimeters of mercury pressure. And how would you know that, or how would I know that? There's a clever little way we can tell, and it starts to come a little bit green. If you keep on pumping, it will say 300, but essentially once you see the little green colouring coming through there at the very bottom of that little spike, we know we're there, all right? And you can pop your little stopcock up to the bag to make sure you don't have any loss of pressure, all right? So you've primed the line, you've applied your pressure. Hopefully doctor's getting his art line in, all right, and all that's going well over there. And then you can, at that point, give the end of the line to the doctor. Do you remember I said before, when you're doing that, disconnect there, because that's another little extra stopcock we don't need. You can disconnect there, give that to the doctor to attach to the art line, and that should be a good job there, all being well. And then the last thing at this stage for you to think about is the position. So we've done priming, added pressure. I'll just leave that loosely there. It might not stay, I'll bring it back here, I feel. So the last thing to think about at this point, we're going to talk about zeroing the machine and about how to take blood draws and the purpose of that little syringe in another video in a minute or two, hopefully. But for now, we'll talk about just the position. And it's really important to get this position correct. The art line should be positioned more or less level with the patient's right atrium. Okay, so best we can. I think it's essentially mid-axilla line and fourth intercostal space to be really accurate, but we tend to talk about level with the patient's heart, and it depends. If they're propped up a little bit, you might be about there. If they're really low down, you might be somewhere around there. Okay. And then you've got this. So this is a proper transducer holder that we have got, and if you just drop the little transducer into the holder, it should stay nice and securely there, okay? And then you know you're at the right position. If you can't find one of these little clamps and you're really stuck, you can and you will see people just tape it onto the patient's gown or whatever, and that's okay in an emergency, but ideally use the little clamp. I'll just pull that back so Gavin can see there. And you might be, sorry about that, you might be concerned about how will you know which way up that goes or whatever. Well, to me it's sort of logical. The fluid line should be upwards towards the fluid, and the arc line will be downwards towards the patient, alright? And that's, yeah, should be fairly logical there. I think I'll leave that there for this one. In the next video we'll talk about complications of what you're observing the patient for in terms of when they've got the arc line in, then our ongoing monitoring, and definitely we'll have a chat around zeroing it to the machine and how all of that happens and what that means, and then taking some blood draws from the line as well. Okay.